Hey, all. Dr. Jared here. Read an interesting article today that outlined a new record in America, which was that drug overdoses from April 2020 through April 2021 surpassed the 100,000 mark. More than 100,000 Americans died from overdosing on drugs. And while this includes a lot of types of drugs, the number one cause was pain medication, specifically opiates. You may remember pre 2 years ago, there was a lot of focus and controversy. There's actually states in the states of the United States, however you want to say that, suing drug companies and the major distributors of drug companies for falsifying research, lying to doctors, paying people to change electronic health records systems so that their drug gets prescribed more often, and even marketing illegally to patients, stating and minimizing the addictive effects of opiates. Now, many of these suits have finished to the tune of billions of dollars. But the scary part is, something that's flat out being ignored in much of mainstream media is that well over 650,000 people in America have been confirmed that they've lost their lives due to side effects of pain medication. Now, when you think about that, pain can be an absolutely brutal thing, but it's not actually a deadly thing. Yet the medication can be addictive and deadly and lead to other addictions like street drugs like heroin. And it's actually the number one reason people switch to heroin is the inability to get an opiate. So how does that affect you, especially if you're not taking an opiate? I think there's never been a more important time to prioritize your personal health, to invest and put value in your health. It's not just drug overdoses and drug addictions that are killing people. Heart attack rates for 2021 are estimated to be the highest in our country's history. You can surmise some of the reasons for that. RSV had record cases for kids. In that opioid study, one of the more sad things is that the most likely person to die was someone between 25 and 35, and a young adult just really starting their life, not somebody who would lead a full life, but somebody that was starting their life. And even in opioid addiction studies, middle-aged people 30 to 50 are most commonly the ones that become addicted, often due to one injury, a car accident, a back injury. So from a chiropractic standpoint, for those that are afraid of chiropractic, I mean, think about the alternatives. Chiropractic has less than one death per 3 years, and those are deaths that they attribute to a chiropractic adjustment that can have been as much as 58 days previous. So from a safety perspective, a health perspective, a prevention perspective, so many different things perspective. Now adding in things like the 5 essentials: nutrition, eating healthy, losing weight, exercising. These things are great for your immune system. They're great for prevention of heart attacks. They're great for pain reduction due to inflammation reduction. Investing in your health financially as well as with your time has never, ever been more important. And sadly, the opposite has been true over the last couple of years. There's actually been less people that have invested due to fear, due to in many cases justifiable reasons. But the reality is, at some point, each and every one of us has to decide, are we actively investing in our health as much as we should? And if you are, I want to celebrate you. If you need some motivation, I'd certainly encourage you to watch our metabolism masterclass that was just released, or take some other action step that just helps you live a better life. Hope that study helps motivate you. Hope you have a very blessed day.